Inflammation, a natural defense mechanism of the human body, plays a pivotal role in safeguarding us against harmful invaders and promoting healing. But there seems to be a lot of facts and also a lot of fiction, so we are going to bust some of those myths in this video. Myth busting. Common misconceptions about inflammation. Myth: inflammation is always a bad thing. Fact: while chronic inflammation can be harmful, acute inflammation is a vital part of the body's healing process. It helps to remove pathogens, repair damaged tissues, and initiate the immune response necessary for recovery. Myth: all inflammation is visible and easily noticeable. Fact: inflammation can manifest in various ways, including redness, swelling, and pain. However, not all types of inflammation are visible or immediately apparent. Internal inflammation, such as that occurring in organs or tissues, may not exhibit external symptoms. Myth: inflammation is solely caused by infections. Fact: while infections can trigger inflammation, it can also arise from other factors, including autoimmune disorders, trauma, allergies, and environmental triggers. Inflammation is a complex response involving multiple pathways and mechanisms. Myth: anti-inflammatory drugs are always the best solution. Fact: while anti-inflammatory drugs can be beneficial in certain situations, they may not be suitable for everyone or every type of inflammation. It is essential to identify the underlying cause of inflammation and consider alternative approaches, such as lifestyle modifications, diet changes, and natural remedies. Myth: a high-sensitivity C-reactive protein test is the definitive indicator of inflammation. Fact: while HACE-CRP levels can be used as a marker of systemic inflammation, it is not the only test or the sole indicator of inflammation. Other markers, such as cytokines and imaging tests, may be necessary to provide a comprehensive assessment of inflammatory processes. Myth: all anti-inflammatory diets are the same. Fact: anti-inflammatory diets can vary in their composition and recommendations. While there are common elements, such as emphasizing whole foods, fruits, vegetables, and healthy fats, individual responses to specific foods may differ. Personalized approaches may be necessary to identify trigger foods and design an optimal diet plan. Myth: inflammation is solely a physical phenomenon. Fact: inflammation can also have emotional and psychological aspects. Chronic inflammation has been linked to increased risk of mental health disorders, including depression and anxiety. Addressing the mind-body connection is essential for comprehensive inflammation management. Fact check: the truth about inflammation. Now that we have debunked some common myths surrounding inflammation, let's explore the facts about this vital biological process. Understanding the true nature of inflammation is key to comprehending its causes, effects, and the body's response. Here are some important facts. Causes of inflammation. Inflammation can be triggered by various factors, including infections, injuries, autoimmune disorders, allergies, and exposure to toxins or environmental irritants. Each of these stimuli can initiate a cascade of immune responses, leading to inflammation. Effects on the body. Inflammation is a complex process that involves the release of chemicals, such as cytokines and prostaglandins, and the recruitment of immune cells to the affected area. In acute cases, inflammation helps to eliminate pathogens and repair damaged tissues. However, chronic inflammation can lead to tissue damage, organ dysfunction, and the development of chronic diseases. The body's response. When the body detects an injury or infection, immune cells release pro-inflammatory signals, such as histamine and cytokines, to initiate the inflammatory response. Blood vessels dilate, allowing immune cells to reach the affected area. The increased blood flow causes redness and warmth, while the release of fluid leads to swelling and pain. Systemic versus localized inflammation. Inflammation can be localized, affecting a specific area of the body, or systemic, involving multiple organs and tissues. Systemic inflammation often occurs in chronic conditions like rheumatoid arthritis or inflammatory bowel disease, where the immune response affects the entire body. Role in chronic diseases. Chronic inflammation has been implicated in the development and progression of various diseases, including cardiovascular disease, diabetes, Alzheimer's disease, certain cancers, and autoimmune disorders. Prolonged inflammation can contribute to tissue damage and disrupt normal physiological processes. Balancing inflammation. Maintaining a balance in the inflammatory response is crucial. The body's immune system has built-in mechanisms to regulate and resolve inflammation once the healing process is complete. However, when the immune system fails to regulate inflammation appropriately, chronic conditions can arise. Lifestyle factors and inflammation. Lifestyle factors, including diet, exercise, stress management, and sleep, can significantly impact the inflammatory response. Poor dietary choices, sedentary lifestyles, chronic stress, and inadequate sleep can promote chronic inflammation, while healthy habits can help reduce it. Inflammation and health. The bigger picture. Inflammation is not just a localized response to injury or infection. It also plays a significant role in overall health and disease. While acute inflammation is a necessary and beneficial part of the body's healing process, chronic inflammation can have far-reaching effects on various systems. Let's explore the link between chronic inflammation and several health conditions. Cardiovascular disease. Chronic inflammation has been closely associated with the development and progression of cardiovascular diseases, including atherosclerosis, hardening of the arteries, coronary artery disease, and stroke. Inflammatory processes can contribute to the formation of plaques in blood vessels, leading to reduced blood flow and increased risk of heart-related events. Diabetes. Chronic inflammation has been implicated in the development of insulin resistance, a hallmark of type 2 diabetes. Elevated levels of inflammatory markers can impair insulin signaling and disrupt glucose metabolism, contributing to the progression of the disease. Autoimmune disorders. In autoimmune disorders, the immune system mistakenly attacks the body's own tissues. Chronic inflammation is a key feature of autoimmune diseases, such as rheumatoid arthritis, lupus, and inflammatory bowel disease. In these conditions, the immune system remains in an activated state, leading to tissue damage and chronic inflammation. Neurodegenerative diseases. Increasing evidence suggests a link between chronic inflammation and neurodegenerative diseases, like Alzheimer's and Parkinson's. Inflammation in the brain can contribute to the accumulation of abnormal protein deposits, neuronal damage, and cognitive decline. Cancer. Chronic inflammation has been associated with an increased risk of certain types of cancer. Prolonged inflammation can lead to DNA damage, cell mutations, and the promotion of tumor growth. Inflammatory conditions like hepatitis, colitis, and chronic infections are known to elevate cancer risk. Obesity. Adipose tissue, or fat cells, produce inflammatory molecules called adipokines. Excessive adipose tissue and obesity leads to an increased production of pro-inflammatory adipokines, promoting a chronic low-grade inflammatory state. This inflammation is linked to insulin resistance, cardiovascular complications, and other obesity-related health issues. Recognizing the role of chronic inflammation in these health conditions highlights the importance of managing and reducing inflammation for overall well-being. Strategies such as adopting an anti-inflammatory diet, engaging in regular physical activity, managing stress levels, and getting adequate sleep can help mitigate chronic inflammation and reduce the risk of associated diseases. While inflammation is a natural response, chronic inflammation can have detrimental effects on our health. Fortunately, there are several practical tips and strategies that can help manage and reduce inflammation. Here are some actionable steps you can take. Follow an anti-inflammatory diet. Incorporate foods rich in anti-inflammatory properties into your diet. Emphasize fruits, vegetables, whole grains, healthy fats, such as those found in avocados and nuts, fatty fish, like salmon, and spices with anti-inflammatory properties, such as turmeric and ginger. Limit processed foods, sugary snacks, refined carbohydrates, and foods high in trans fats. Maintain a healthy weight. Obesity and excess body fat can contribute to chronic inflammation. Aim for a healthy weight range through a combination of regular physical activity and a balanced diet. Consult with a healthcare professional or registered dietitian for personalized guidance. Engage in regular exercise. Regular physical activity has anti-inflammatory effects on the body. Incorporate both aerobic exercise, such as walking, jogging, or cycling, and strength training into your routine. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise each week. Manage stress levels. Chronic stress can contribute to inflammation. Practice stress management techniques such as meditation, deep breathing exercises, yoga, or engaging in hobbies and activities you enjoy. Prioritize self-care and make time for relaxation. Get quality sleep. Lack of sleep or poor sleep quality can increase inflammation levels. Establish a regular sleep schedule. Create a conducive sleep environment and practice good sleep hygiene habits. Aim for 7 to 9 hours of quality sleep each night. Limit alcohol and tobacco use. Excessive alcohol consumption and smoking can promote inflammation and increase the risk of chronic diseases. Limit alcohol intake to moderate levels and avoid tobacco products altogether. Consider supplements. Certain supplements, such as omega-3 fatty acids, curcumin, found in turmeric, and green tea extract, have shown anti-inflammatory properties. However, consult with a healthcare professional before starting any new supplements to ensure safety and effectiveness. Seek medical advice. If you experience persistent or worsening inflammation, it's essential to consult with a healthcare professional. They can evaluate your symptoms, conduct appropriate tests, and provide personalized recommendations and treatment options. Remember, managing inflammation is a holistic approach that involves multiple factors. Implementing these tips and strategies, along with regular medical checkups, can help you effectively manage inflammation and promote overall health and well-being. Let us know how you manage inflammation in the comments below.